First of all, a person can go to integrated doctor and get hormone replacement. And if they do, in your mind, what will be the ideal form of replacement? Because there are creams, there are injections, and there are also pellets. Like what are your thoughts on replacement? I think we're really talking about men right now.
Yeah, I could talk about women too. So I will correct you as I do everybody else. You don't want to use the term replacement, right? Because if you use the term replacement versus optimization, you're basically replacing a hormone that is cessating as we age, right? So we don't want to replace it. We want to optimize it. And that's why I took my first book, which was the TRT manual, which was testosterone replacement therapy, to TOT, which is testosterone optimization, which pretty much most of the doctors in the space say that now, because it is true. It's about optimizing it as we age and not replacing it, because obviously it's cessating, but you're technically right? But at the end of the day, it really comes down to the individual patient and adherence, right? Because some people are not going to inject themselves. The injectable testosterone preparations are now very, highly resolvable, and they can go through a very thin, fine gauge needle, and you can inject in like the abdominal fat or the, upper gluteal fat pad. So it's, again, painless for somebody that doesn't have that fear. So, the answer is really, what is a patient going to adhere to? Now, I say that, but there's definitely some delivery systems that are fraught with problems and errors, and I'm happy to explain that, to you, or why that is. But for the most part, men and women equally are going to do best on either micro thin injections, and you want to do an injection that is, very, very close to mimicking the body's endogenous production and release. So that's going to either be daily or every other day. In a perfect world, you want to inject daily, because again, you're going to mimic the diurnal pulse of testosterone from both males and females by doing that. Now, but is that realistic, Joy? Because again, most people are busy, they have interesting lives, they're traveling. Who's going to inject themselves every day? Very few people. Now, I truthfully do know this. I know thousands of people that do, because they make that morning daily injection part of their routine. It's like brushing your teeth or meditating or doing your journal, your gratitude journal or whatever. So it just becomes a part of their life. But the second most, efficient would be transdermal. Now, for women, you can go in the inner thighs, the vaginal lips. Some people will go, depending on the solution now, like in the inner, outer arms. Truthfully, it should be somewhere close to center mass. Again, just for crossing the blood-brain barrier, getting into circulatory system the most efficient way. For men, and this is how I do it, by the way, now, after 17 and a half years of injections, transscrotal. So you're going to place a compounded 2%, which is a 200 milligram gram mol cream, and you can either use HRT or TRT base. Again, all the compounders make that. There's now new formulations in the marketplace called Atravaceous. And again, just like in my business, they claim, oh, it's liposomal. So it, absorbs better, and it's, lipophilic. So it's absorbing in the skin or through the skin better. But in truth, like when you really start looking at the tests, they all absorb about the same way. It's just another way that the pharmaceutical companies make money by telling you that it's liposomal and it's more expensive. But between all three of those delivery systems, if you put it on the base of the scrotum for a man, the scrotum is this is scientifically proven, by the way, there's like 8 studies now. It's 8 times more efficient from an absorption standpoint at the skin at the base of the scrotum. Again, because of the very thin nature of the membrane of the skin right there. So if you place it right there, first thing in the morning, you're going to get a very, very similar release to, your actual natural production of testosterone. Now, some people, and again, this is scientifically proven, when they initiate that type of therapy, will have a DHT spike, which is dihydrotestosterone, because again, right there in that location, you will get a higher androgen signal from DHT release. But anything that would cause a noticeable, like, a PSA elevation, or even maybe like a person would feel like they're starting to have a little bit of hair loss from it, it's totally transient. Again, this has been studied. And it will go away after like a couple of weeks. Just depends on the patient. The good news about transscrotal testosterone therapy is because of that increase in DHT signaling, you will have better sexual function. You'll have stronger, thicker erections. And it doesn't seem to cessate like it would if you were using injectable preparation. But beyond that, everything is equal. A lot of people say, well, what's better for, endurance or muscle gain or dopamine signaling or, improved cognition? And I always say none, they're equal, right? So when they're done right, but just to compare and contrast, if you're going to use injectable daily or every other day, and if you're going to use transdermal, for a man, it's at the base of the scrotum. And for a woman, it's like inner thighs or vaginal, right? Now, the other formulations, or I should say delivery systems, they are formulations that a lot of people use, which are fraught with errors, are pellets. And the reason that is, and I've talked about this at length, I've been on many podcasts to talk about this, pellets molecularly cleave differently in every individual, right? Because every individual is biochemically unique. So some people can have a pellet inserted and it works exactly as it's intended. One pellet every 8 to 10 weeks and they feel great. The pellet lessens towards the end and they are okay, right? But the average person who has a pellet inserted cleaves the testosterone at different rates and speed. And so you see a lot of times people run out, right? They're 8-week insertion and 5 weeks, they're dying because their body has already cleaved through all of the testosterone ester. And then, it becomes a mess. The other issue with pellets, which I really don't like, is that you're relying on a non-surgical doctor to insert a pellet. And you will see a lot of botched surgeries. I have an entire desktop folder, which for confidentiality purposes, I cannot show you, right? And I don't even have the right for these guys to send me these emails, but they're always like sending me the emails saying, look at this, I have an abscess, or a cyst, and I look at them and I'm like, delete, why did you send me that? But, I've seen crazy pellet insertion. So I hate pellets, period. Again, I don't want to say that there isn't a place and a time, because for all medications, there's always a place and a time, right? Like even the most horrible big pharma preps, there's still somebody out there that could use them for something, but I'm anti-pellets because of that. And now they have, there's guys out there now, they've got an oral. Now, the problem with the oral is it works great for women, but it doesn't work well for men because it's not strong enough to truly optimize a man. It will for a woman. So they're the new ones, I think it's called Testo. There's probably some other ones now that are out there now that are FDA approved. This is a 30-year-old pharmaceutical preparation from Europe. And it used to be called Andriol. And all the bodybuilder, performance enhancement guys in the 70s and 80s, would take that if they could get a hold of it, towards the end of their competition cycle, because it was such a mild androgen, but it still gave them like a tiny bit of, anabolic signaling, that testosterone wouldn't. And the reason they would use that is because it didn't create water retention like a higher dose of cypionate or ananthate, injectable testosterone. But they always knew, and we know now, that because it's oral, it has to pass through the liver, and it never produced the same results that a transdermal or an injectable formulation or preparation would. So even, so again, here we are, big pharma reinventing the wheel 30 to 40 years later, selling this to doctors. I see this all the time because I have a lot of physicians, who follow me in the integrative and the functional medicine space, who will email me about these things. And I'll tell them, don't prescribe them, don't use them, because you're not going to get any benefit with a man. You might with a woman, but again, you're taking an oral testosterone formulation that's more expensive because it's newer, and again, recently FDA approved, and, you're not going to get better than you already have the tried and true transdermal and injectable formulations. So stay away. There's other ones we could talk about, like troches and patches, but I mean, again, they're all compared to the true tried and